morning, everyone. I think I'm going to miss these Zoom meetings when they're gone. I really like seeing everyone and then faces, and I feel like I haven't seen very many people in the last 5 weeks, so hello to everyone. Kristy Campbell, thank you so much for joining us today. We're very excited to have you with us. As most of you guys do know, if you haven't seen Kristi on TV or heard her on the radio in the last 6-ish weeks, she is the director of the Cole County Health Department. And first of all, Kristi, I just want to say thank you to you and your staff. You are the poster child for being on the front lines and representing Cole County, and we're so happy to have you representing us, and a big thank you for all your work. I know that you and your staff have been working tirelessly in the last several weeks, and we thank you very much for your very, very hard work and for your public service. So thank you.
Thank you. I appreciate that.
So just kicking off, let's just talk about where we are today. So can you just bring us up to speed on where we are today? I know that Cole County and the stay-at-home order expired a week or so ago, and we are now following the governor's stay-at-home order. But can you just talk to us about where we are today and what's to come in the next week or so?
Sure. So throughout this whole process, the Cole County Health Department has worked collaboratively with other city and county officials. We've had county departments that have been involved in our emergency operations center. We have worked with a lot of city partners. We strive from the beginning to be very proactive in this process, and we did stand up our emergency operations center early before we had a first case because we wanted to be prepared. We wanted those first responders to know what kind of PPE they needed to wear, what they needed to do if they got those calls. So we've been very proactive, and I will say that my staff have worked very hard to be prepared and to know how to respond to questions. And we've also had great partnerships throughout the community with several partners. So I can't say that the health department has done it alone. We've had so many great partners, and I appreciate everyone so much. So right now, we did let our county stay-at-home order expire on April 25th because the governor had his order in place. Throughout this whole process, we have striven to make our decisions based on public health, not on political or public pressure or panic about what's going on with the virus. We've looked at the public health data. We've looked at the Center for Disease Control Prevention website, CDC, as I'll refer to it. We've taken guidance from the Missouri Department of Health and Senior Services. We have really tried to do what is right for our community at the time with the data that we have. At the time that we decided that we needed to do a stay-at-home order for Cole County, there was 3 main factors driving that decision. One was that we did have a case that we suspected was community spread. That means that we could not identify the person that case contracted the virus from. It wasn't a known case, contact with a known case, and it wasn't travel related, and that was concerning to us. We also had several people that had traveled because of spring break. Even though travel was a high risk factor at that time, we knew that several people had traveled, and when they came back into the community, we needed them to stay home for 2 weeks. And because the incubation period is 2 to 14 days, and we needed them to stay home and not possibly bring that virus into the community. And at that time, we also had like 200 tests pending from our testing facilities, and that was worrisome to us. So and the governor had not done a stay-at-home order for the state yet. So we decided at that time it was best for Cole County for us to do a stay-at-home order and slow the spread of the disease, the virus, because the point of stay-at-home orders is never to eradicate the virus. That's not possible. It's in our community and it's going to be here. The point of the stay-at-home order is to slow the spread enough to where the public health system, meaning the health department, can get up to capacity. So if we have a lot of cases, we can do those contact tracings. We can investigate all of the positive cases. And it's also to give the healthcare system time to adjust and to bring their capacity up. Because if everyone was to get sick at the same time, it would put a significant strain on our healthcare system, and they might have to make decisions about who gets the ventilators or who gets the ICU beds, and we never want to put our healthcare providers in that position. So at that time, we felt it was best for us to do a stay-at-home order. And then the governor followed us about a week and a half later. So when ours was set to expire, it was slightly more restrictive than the governor. And we thought by letting it expire, we would kind of come down to where the governor was at. It was just, one step to sort of getting some of our businesses open. And it was kind of our first step to recovery, because we are doing very well here in the county with our cases. So right now we are under the governor's stay-at-home order until Sunday night, May 3rd at midnight. And then Monday morning, we will start into phase 1 of recovery. Right now we have had 51 cases in Cole County, but we only have 3 active cases at this time.
So speaking of next week, so I know our staff had a pretty lengthy conversation yesterday on Zoom on how we were going to move forward next week, to protect our staff and to our members that potentially could be walking in. We're not really anticipating that we'll have many walk-ins. We think that people, probably will only do still the essential things that they have to do as far as getting out to grocery stores and things like that.
Right.
We probably won't have a lot of walk-in traffic. But can you give some of our businesses, and we have 86 people on our Zoom today. So you're a hot topic, Kristi. Can you give us some advice on some things that we can do to protect ourselves? So, for example, one of the things that we discussed was putting a table in our vestibule, having hand sanitizer available, having potentially face masks, making it mandatory for people that walk in to have a face mask. But then that means that we need to be providing face masks, and it seems like there's a lot of available face masks out there, as well as with hand sanitizer and wipes. I went to a big box store yesterday looking for wipes for the office, and they were totally depleted. So can you give us a little bit of advice on how we could move forward safely next week?
Sure. So that's what we're trying to do, is focus on education instead of doing more orders this week to make things more restrictive. We felt it was best for us to focus on education. So if you visit our website, colehealth.org, we have uploaded 10 different guidance documents. One is just for businesses. There's one for mass gathering, childcare facilities, pools and gyms. Like I said, there's 10 different documents out there. And if there's another specific industry we need to address, we'd be happy to do that. But I think the most important thing for people to realize is how the virus is spread. It's droplet spread. So it's really close contact for 10 to 15 minutes within 6 feet with someone who is symptomatic, and you are exposed to the coughing, the sneezing, the secretions, the droplets that they have. So Chesney Schulte, who is our communicable disease coordinator, we were talking about that here in the office yesterday. So exchanging those papers, someone would have to cough on the paper, hand it to you, you would have to touch it, get it, and then touch your eyes, nose, mouth to expose yourself, So that's why that hand washing, that hand sanitizer is so important. If you're all in the office and you all have your own separate offices and you're not sharing, you're not having lunch together and things like that, and you go to someone's office to talk to them and you stand at the doorway 6 feet away, you conduct your business, then you go back to your office, there's no exposure there. People need to realize that you have to be very close. It's those close household contacts where we've really seen the disease transmission. And we've actually had families that live together in very small houses that did not spread the virus to other family members. So those typical workplace interactions, where you're 6 feet away, you're not sharing cups, you're not sharing, the eating lunch together, things like that are not of concern. But I know that the Missouri Chamber of Commerce put a document out there. We downloaded it about workplaces. And then, like I said, we've shared guidance on our website if people do need some guidance about how to be safe in their workplace.
Do you feel like businesses need to have their procedures posted if they're open to the public, and so people know what the expectations are?
I think that would help people a lot. There would be less confusion, and they would feel like you were trying to protect them as they were coming in, and then your employees would also know that they're protected, and everyone knows what's expected of them. We have a sign as soon as you come in our door. We would like, clients coming in to sign in and put a mask on and have a seat. And then if they're going to be brought back for clinic services, we will be taking their temperature and talking to them about what services they need before they're brought back to a clinic room with a nurse. But when they're brought back to have services with the nurse, they're going to be in very close contact with that person. So we need them to put a mask on, and we need to make sure that they don't have a temperature. So some of it will depend on the nature of your business and what they're coming in for. But everything that you can do to keep your clients and your staff safe should be done.
Okay, you guys, I'm going to keep on asking Kristi questions unless I see any in the chat room, because I have all kinds of questions for her. So,
okay.
One of the things that I feel like we're very blessed in Cole County, and you talked about this a little bit earlier, is the fact that we have only had 51 cases in Cole County.
Right.
47 recovered, thankfully. One death, which was, a huge impact to our community, Dr. Huber, which we've been thinking about his family and his staff and his business. So I feel very fortunate in that regard. And we have some very large manufacturers. I know the county to the west of us have had a lot of cases in one particular manufacturer. And can you talk to us a little bit about that? Why do you think that is? And do you feel like Cole County has done a pretty good job with all the procedures going through the COVID?
I think that our community has done very well. I think the businesses have taken it very seriously. I think that individuals that we have had come as positive cases have done well with quarantining and knowing what they need to do. As soon as we are notified of a positive case, we make contact with that person, and we have them identify to us all their close contacts. And then we get in touch with those contacts and say that they've been identified as a close contact to someone who has COVID-19, and we ask them to quarantine for 14 days. And if they show symptoms, we work with them to go get tested. So we've been very aggressive with our contact tracing and our investigations. And our people that have been positive have been very compliant. We've gotten very few complaints about people violating their quarantine. People have wanted to do the right thing. And if we've had situations where we've had positive cases in businesses, we've been very aggressive about isolating that person and getting it taken care of so it doesn't spread within the community and it doesn't spread within that workplace.
Very good. Okay, I'm going to go to the chat room. And first of all, Kim Marshall says, great job, Kristi.
Thank you. I appreciate that.
Claudia Cook from the library. She says the library is planning on quarantining our materials when they are returned for 72 hours. I understand the virus can live on plastic surfaces for this long. Most books have plastic covers. Do you have a comment to that or a response to Claudia or a comment?
I think that doing that out of an abundance of caution is good. And there is a lot of different evidence and articles out there about how long it can live on those surfaces. Like I said, our communicable disease nurse was explaining it yesterday that it's a lot of steps for someone to cough on their hand, put it on that hard surface, the next person to pick up that hard surface, they touch it. And so the chance of spreading the virus that way is very low. But I think if they want to do that out of an abundance of caution, that we're not going to tell them not to.
Gotcha. Then another question from Kim Marshall that's near and dear to my heart since I'm a week late in my hair appointment.
Right.
Would you address best practices for salons?
Sure. Actually, we put an entire guidance document on our website just for salons. We had, our community is so great. We had actually received some guidance. I guess a group of stylists got together and they sent us some ideas, and really great ideas. So we took that and we made it into a guidance document on our website. But it says things like having people wait in their cars till it's their turn, having them wear a mask, not bringing the whole family unless, only the person getting services should come. and that they should space out the chairs or the workstations so they're not directly by each other, things like that. So that document is on our website, colehealth.org.
Perfect.
Mm-hmm.
We had this exact question yesterday on our staff meeting Zoom call. How do you manage multiple stalls, restrooms, and offices? I mean, we talked about potentially not even allowing people to come into our office to utilize the restroom, but we are planning on having at least 1 or 2 meetings next week, and we don't really feel like that's feasible to not allow people to use the restroom. So how do you manage that?
Well, remember how I talked about how the virus is spread. So if people are washing their hands and, they use the restroom, wash their hands when they come out, don't, those frequently touched surfaces should be cleaned to like bathroom doors and stuff. But if people are washing their hands after they use the restroom or using the hand sanitizer when they come out, there's really no risk. I mean, like I said, think about how the virus is spread from those droplets. So it's all about hand washing and cleaning those frequently touched surfaces.
Which people should have been doing
Right.
all along.
Yeah. Right.
Claudia Cook, does this sound like a good practice or excessive? I'm not sure exactly what she's referring to.
I think she's referring back to the book thing.
Okay.
So yeah, if she wants to talk more about that, we can talk about that offline, because I want her to do everything that's protective for her staff and the patrons of the library. And I don't have the guidelines memorized as to how long it can live on every surface. Like I said, that is not the primary way it's spread. It's spread from person to person contact. But Claudia, if you want to give me a call, or if you want to give Chesney, our communicable disease nurse, a call, we can talk about that. But just remember, the risk of spreading that virus with those inanimate objects is very, very low.
She asked another question, which I was curious about as well. She said,
Sure.
Also, the fireman came to the library yesterday to look at our normal occupancy and said, I would need to ask you about best practice occupancy during this reopening phase. Can you help me with that? And that's
Sure.
one of the questions I had was,
Right.
I know the 10-person guideline, but what if, does it matter whether you have 30,000 square feet versus 3,000 square feet? I mean, how does that work?
Right. So the 10% guideline has expired, or is expiring Sunday night. In the new guidance for retail sales, there's a specific section about if you have 10,000 square feet, it's like 25% or less of the building code. If you have 10,000 square feet, it's 10%. But that is for retail spaces. So spaces like the library or office places, it's not really about the number of people you have. It's about the space between them. Because if you have a gymnasium, it really doesn't matter if there's 10 people or if there's 20 people in there, as long as they're all 6 feet apart and they're not exposing each other, having that direct face-to-face contact with it, they're 6 feet apart. So with the new guidance, there's no limit of 10, and those retail sales places have specific numbers listed. Everyone else, it's 6 feet away.
Okay, so restaurants, same situation?
6 feet away.
Okay, very good. And do you anticipate a lot of restaurants opening next week?
I don't know. Yeah, we haven't, we've had some questions, and I think that, and I know that in the Missouri Restaurant Association talked in one of the governor's calls, and I think they're doing a lot of education about how the safest way it is for them to do, to be able to do business. And I think it'll probably, for many of them, it'll just be a logistical issue. How many tables can we have in here, keeping people 6 feet away, and still be safe?
Okay. This is something I thought about too, because I've been purging my house during this time. What about donated items if you have a nonprofit resale shop? We are worried about clothes and home good items.
Like I said, there's some different guidance out there on CDC's website about how long it may or may not live on surfaces. But from what all of us here at the Health Department have read, that is not the primary way that COVID-19 is spread, and the risk of contacting COVID-19 from an inanimate object is very low.
Okay.
Unless right directly from that person. Like if someone who has it drinks out of the coffee cup and hands you the coffee cup, and then you drink out of that same spot, that's a bit different. But a piece of clothing that someone wore 3 days ago and donated, the risk of contracting it from that piece of clothing is low.
We have 94 participants, which is the highest Zoom that we've had thus far. So just FYI. What about the COVID case? If the COVID cases start to increase, what will the numbers have to look like for a new stay-at-home order to take place?
From the guidance that we've received, it's going to depend on where the cases are and how we believe it's spread from person to person. If the DHSS is really focusing on that box-in approach and aggressive testing for the population that is affected. So if we see a case, and like use the manufacturing example, we see a case in one of the manufacturers, they're recommending that you go in and test everybody that works in the facility to determine if people who are asymptomatic actually are positive with the virus, or if other people that have very mild symptoms have the virus, we would be aggressive. And like I said, it's not about the number of cases that we have for the stay-at-home order. The stay-at-home order was to prevent the healthcare system and the public health system from being overwhelmed. So if we get a lot more cases, but they're all very mild, and it's because we tested more people, as you test more people, you'll probably get more positive cases. So if we get a lot more cases, but they're very low, they're low risk population, they don't develop any adverse health effects, they don't need to be hospitalized, it's not a concern. Stay-at-home orders are to protect the healthcare system from being overwhelmed, so we don't run out of ventilators, we don't run out of ICU beds. So as we move forward, it's not just about watching the number of cases, it's about what's happening with those cases, what's happening in our public health system. If we can continue to do those contact investigations, and we may have to ask for help with that, and what's happening in our hospitals. And we have a very close relationship with them. They have been attending our EOC, and we've been keeping track of what's going on there, because that's the point of the stay-at-home order.
So back to the testing, will antibody testing be available in Cole County?
I know the hospitals are looking into it, and they're trying to get it here. We've also heard from Department of Health and Senior Services that they have these rapid, on a federal level, rapid machines available. We've looked into getting the one from ourselves. The issue right now is making sure the testing is viable and accurate. And I think that there's still some questions about the accuracy of those tests. So whether it's a rapid test or the serology blood test, we want that to be available here, but we also want it to be the most accurate possible. So we just need to let that technology catch up.
Okay.
But I think it will be available. I just don't know when.
Okay. On a personal note, I had symptoms last week.
Mm-hmm.
I called my doctor because I wasn't exactly sure what the protocol was.
Right.
Went in, they kind of treated me like I had the plague. They met me at the door. They sent me away from everyone. I got in immediately.
Right.
Long story short, they sent me to the CAP region drive-through to be tested.
Mm-hmm.
And thankfully, I ended up with a respiratory virus, and it was not COVID. I'll make that strict, very clear. I did not have the virus, which I was extremely happy about.
Relieved.
But kudos to, I got in, I got out. It was very quick. It was painless, and I had my results within
I heard
24 hours.
Well, good. I heard that the test was not exactly painless.
Well, it's if you've had the flu swab, it's basically the same.
Right.
So I was very happy to get the results within 24 hours because I had heard horror stories about it taking a very long period of time.
Well, at the beginning, one of the hospitals did have a lab that was taking longer, and they went ahead and contracted with the new lab that was faster. And then if you qualify for the state public health testing, lab testing, which they're increasing, it is a 24-hour turnaround. So a lot quicker now than it was at the beginning.
Very good. Rick Mihalovich from a local restaurant. Upon reopening, strict guidelines will be followed. We have moved our tables 6 feet apart and are limiting groups to fewer than 10 people.
Good.
We will be adhering to strict sanitation procedures such as sanitizing tables and chairs after each use. Paper menus will be disposed of after each use. Drinks will be served in styrofoam or plastic, and condiments will be single-serve packets. We are asking that you help us in keeping everyone safe and healthy. If you do not feel comfortable being in these settings, we certainly respect your decision, and please do not come in if you are not feeling well. So
sounds like they're doing great. And I think that's a good message for everyone. If you're sick, stay home. No matter what you have, if you are sick, stay home.
Absolutely. Okay. From Kelsey Brown, do we know what Governor Parsons phase 2 will look like? Will it just loosen the 6-foot restriction?
Unfortunately, as a local public health agency, we learn what the governor's plan is going to be when everybody else learns when the governor's plan is going to be. We get no advance notice. DHSS works with us, and they're a partner agency. We have got no additional funding from DHSS for this COVID-19 crisis. This is my soapbox story, but as you know, public health funding in Missouri on a per capita basis is typically last or close to last in the nation. Right now, we're 49th per capita. So we don't get any advance notice of the orders either. I learned what the phase 1 was going to be at 3 o'clock on Monday with everyone else.
Okay. So if you had a crystal ball, which I know you don't.
I keep telling everybody mine's broke.
I mean, can you kind of talk to us about the rest of 2020? So what do you think is going to happen in the fall? What do you think is going to happen, later this year? For example, we have a chamber barbecue that we've had for Susan Neal's on here, but 30, 40 plus years. Can you see that we will have 500 people in one location anytime this summer to be able to have those type of events again?
I think we're going to learn a lot more over the next couple of months. I think as we open things up and people get back to normal life, I think we're going to learn more. I think people are going to continue to be more aware of how close they are to other people. I think people have learned a lot about how germs are spread. I think they have learned a lot about washing their hands, how important that is, cleaning, disinfecting. I think people are being very creative about how to spread people out and not have people so close. We've had a lot of schools ask about graduation and how we can be creative and still have those events, but not have people sit on top of each other. And so without knowing what the governor's phase 2 is going to be, without knowing what our cases are going to be, without knowing what that healthcare capacity is going to be, it's hard for me to say what's going to happen in the next few months. I would like for us to be able to have events like that. Believe me, probably no one else on the call wants life to go back to normal as much as we do. So we want that to happen, but we want it to be in the safest way possible. So there's been a lot of speculation about whether or not this will come back in the fall like the flu. We don't know. And but the good thing is we're all learning more every day about it. And they're considering things like a vaccine, which I hope people would participate in. And hopefully as more people are exposed, they will build up that immunity and will realize that it's not as debilitating to all people as they first thought.
So Matt Green wants to take a poll. So people are going to raise their hands. Would you attend a 500-person meeting next week? I don't know if he means inside, outside, but show of hands.
Yeah, and I would say that outside makes a difference than inside, but
right. So show of hands, how many people would attend a 500, let's just say outside, 500-person meeting outside next week? Raise your hand.
I can't see everybody.
Yeah, I'm not seeing many.
But I'm typically an introvert. Like if it wasn't COVID-19, I probably wouldn't. It would be too people-y for me. So
too people-y. Never heard that before.
Yeah.
I'm hearing, no, not me. I bet zero. Nope, no way. Yes, I would.
I saw some people raise their hands. Some people say, yep, wouldn't bother me.
There's a handful.
I guess, yeah. I mean, if it was at the fairgrounds, sure. That's a big fairgrounds. People wouldn't be right on top of me,
Right.
Right.
Okay. With Boone County maintaining slightly tighter guidelines, should employees living in Boone and working in Cole be handled differently? encouraged to stay at home, question mark?
As long as you're following the same guidelines we talked about, 6 feet away, washing your hands, staying home if you're sick, no.
So what about those employees that, let's say you have a staff of 10 and 2 people do not feel comfortable coming to work. I heard the governor say, if your employer is calling you and saying that you need to come to work, you go to work. So what about those individuals that do not feel comfortable coming into the workplace?
I think that is going to have to be handled by the employers. That's not something we would get involved in. We could provide education. We could provide education to the employer to make the work environment as safe as possible. But I think that businesses need to handle that with their staff directly. And I think that employees need to decide for themselves and make their own decisions.
So can businesses require staff or people coming in from the public require the wearing of mask, gloves in their place of business?
Well, I know that we are asking our clients to put a mask on before, like I said, those close personal services with nurses. But I would say that as far as employers, that would probably be a question they need to ask their legal counsel if, because I know that hospitals require their staff to have the flu shot, and that's been, a legal issue for them. So I would say that mask issue would also be a legal issue, and they need to address it with their legal counsel.
Do you see a lot of lawsuits coming out of this pandemic?
Yeah, I don't know.
Yeah.
Thank you.
Okay. This one, she says that this has already been asked. I apologize. I hopped on late. Juggling, working, stay-at-home mom, which a lot of people are juggling things right now.
Right.
Are there, in fact, various strains of the virus out there? If so, how does that impact the treatment, vaccination strategies that are being introduced? If not, what is the likelihood of various strands developing, and what could that look like for our community going forward, treating various strains?
So, read various articles about this, and coronaviruses have been around for a long time. That's why there's some speculation that children aren't as susceptible to COVID-19 as other populations like adults, because children are exposed to viruses like this in daycare all the time. I know I've taken to the doctor before, and it's not strep, it's not influenza, it's a virus, let it run its course. Well, it was probably a coronavirus. So there are many forms of coronavirus. This one has been identified as COVID-19. I don't think that we know yet about if it's going to mutate or if there's going to be more strains, but there is definitely more than one strain of coronaviruses. That's the common cold virus.
Let's see. How would you recommend employers handle employees that take vacation this summer and come back into the workplace? Good question.
I think that they need to be concerned about that, depending where they go and how prevalent the virus is there. But you could require that person to quarantine at home for 14 days. You could require them to wear a mask. You could just require them to self-isolate in their office. I think that it's hard to make those decisions now because we don't know nationwide what the number of cases are. So I would be concerned about people just traveling and bringing the virus back to Cole County. So I think that we need to really watch nationwide what's going on with the virus over the next few months before like vacation season and before people start traveling a lot.
Is there concern that the public is not getting exposed to the normal amount of germs, bugs that we normally would be exposed to pre-quarantine?
Well, I think that we're all concerned with all the unintended consequences of a stay-at-home order. It was a very difficult decision because you do have to think about the immunity, and you have to think that, God gave us very amazing bodies with amazing immune systems, and being exposed to germs all the time is part of life, and it helps with our immune system. And with the stay-at-home order, the other things we thought about were the kids that wouldn't get food because they wouldn't be at school. Child abuse goes up, domestic abuse goes up, teen pregnancy rates go up, STDs go up. So I think that there is a lot of unintended consequences of a stay-at-home order, and herd immunity and the immunity of our bodies is another one of those consequences that we have to consider.
I know you're out and about and talking to businesses, and this is kind of out of your wheelhouse, but Missouri Chamber recently sent out a survey to all their employers, and there was a 15% response that those 15% of the businesses are not going to reopen. Have you heard of many in Cole County as you are out and about and meeting with businesses that aren't planning on reopening?
Well, we really haven't been out and about meeting with businesses. You know, we've answered a lot of phone calls and they call us and ask for guidance, but we haven't been going around to businesses. Some of them just contact us for advice or other things, but no, I have not heard of, personally heard of anyone that was not reopening. But like I said, they might not tell us as the health department.
Right, right. All right, I'm not seeing any other questions.
Good.
Claudia? I don't know, Kelsey.
I asked one earlier about visiting people in a neighboring state, but I think Kristi kind of answered that, where I didn't know if you had to quarantine. You know, my parents live in another state and I'd like to go see them, but I can't come home and self-quarantine as I'm trying to get back to work.
Well, we would probably talk to you about your contact with them. Like, have they been at home? Have they been sick? Have they been exposed to anyone? Did you have very close contact with them? Did you stay 6 feet away? So it's all about the risk and what contact you had with that person, and knowing, you know, what the contact was and the risk. So if your parents have been self-quarantining themselves and they haven't been exposed to anyone who has COVID, and you go and visit them and you still try to stay 6 feet away and not share drinks with them and things like that. And then when you come back, you just make sure that you keep your distance from other people. You work, but you're not in very close contact with your coworkers. It's a totally different situation. You know, you really have to consider the risk and think through things like that. And it's not a one-size-fits-all approach.
Sure.
Does that help, Claudia?
My parents live in a county that have no cases at all.
Oh, well, there you go.
Yeah, they live out in the country.
Well, that's amazing. So for the risk of you traveling to them is very low. Now, if you're going to go to Atlanta and you're going to go to a conference with 500 people and sit very close and be all up in everybody's business on the airplane and all that, and in the subway, and then come back to Cole County, I'd be a little bit more concerned. So we really want to really evaluate the risk. We don't want to apply these one-size-fits-all approaches to every situation because they're not all the same.
Thank you.
You're welcome.
Speaking of elderly, so a Jefferson City nursing home where my mother-in-law is, they are not planning on reopening unless they're at the end of life situation. So what about those nursing homes? You know, I know that my husband is getting very antsy to go see his 87-year-old mother. And they did have a parade last weekend, which was amazing. So people have been like so creative in being able to see your loved ones. But what about nursing homes? Do you see them opening up anytime, say this summer?
Right. I had anecdotally heard that they were going to go 2 to 4 weeks out past any stay-at-home order. For them, it's probably they will watch kind of the case count and watch what's going on, because that with this, like I talked about the coronavirus is the kids. With the older people, you know, they're very vulnerable. They already probably have some underlying health conditions, and we do need to be very cognizant of them. And maybe they'll wait a couple weeks and see what's going on, and then require some screening before they have visitors come in. You have to have your temperature taken. You have to put a mask on. So I think anything they can do to protect that vulnerable population from any viruses, not just COVID-19, is a great thing.
So we are planning on opening Monday our doors.
Good.
So let's just do a survey. How many businesses here are planning on reopening next week? Raise your hand.
No.
I can't see the gallery. I need to change my setting. You have to let me know how many it is.
I mean, it looks to me like about 25%. Of course, I can't see everyone either. Kelsey, can you kind of, you think about 25% about accurate?
Yeah, we've got 4 pages of people here. So I'm seeing about, I mean, from those that I can see, I'm saying about 25%. That's probably accurate.
And I know.
I would love to know from the people that are not going to be open, why. What is their main worry or main barrier that's keeping them from opening? If they're, because so then I would know if we could have some guidance that we could help provide.
Mm-hmm.
Or something we could do to help, because we are here to help, and we want to provide any education. We want to answer questions, so we would love to provide guidance if it's needed.
I'm getting lots of responses. We will, yes, open now, will be next week.
Mm-hmm.
DeLong's is still closed to public customers, and maybe, I don't know if we want to unmute Amber and let her talk about that a little bit. Claudia, we are pre-opening, getting the library ready for the public. I did wonder if the library was going to open next week, since
They probably have a little work to do. Well, just to remove some of the tables and chairs, space things out. So Claudia and I had kind of emailed back and forth about some of those ideas. It might take some of the business just a little bit to figure out the logistics of it.
Right. And I have heard some businesses are staggering their employees.
Great idea.
Which I think is a great idea as well.
Mm-hmm. I had heard that one of the big insurance companies in Columbia would, during this whole thing, they stayed open, that they had teams. So you worked with the same people every day that way, and they were in segregated parts of the building. So that way, if one person did get sick, it wasn't the whole staff that potentially could have been exposed. It was just that smaller group that was kind of in that wing of the building, which is a great idea.
That is a great idea.
Mm-hmm.
What about on the personal side? I mean, I know I'm getting very anxious to hang out with my besties. Do you have any, advice as far as socially? I've been doing a very, very good job of not seeing my friends. But
I haven't seen my parents since March 8th, and my mom's birthday was yesterday. She was 80. So I'm very anxious to see her. And part of it is just because I've been a little busy and really haven't had much time to go to the lake and see them. But I get it. I'm anxious. But there's no reason why you couldn't start seeing them outside, 6 feet away. Don't share drinks. Like I said, be smart about your friends, just like you're smart about people at work. Mm-hmm. So socially, go ahead and start doing those activities. Just be smart about it. Minimize the risk. And it's good for the soul. We have to think about the mental health consequences that have come from this. Everyone's been under a lot of stress. A lot of people have been trying to get their kids, homeschooling. My daughter, has been we have one home from college that's trying to do their studies at home. My husband's been working at home. It's a lot of stress for everyone, and we do need to get back to that social aspect. That's why we've been trying to say physical distancing, not social distancing, because we want people to have that social interaction that they need while protecting themselves as much as possible.
And I think you told me last night that your daughter's been doing Taekwondo on Zoom.
That's correct, yeah. But she's very close to getting her 2nd degree black belt, so she doesn't want to stop now. So,
awesome, congratulations.
Yeah.
Let me see. AirServe has been open. Our field personnel is wearing PPE when entering homes, maintaining social distance, and wiping down anything that might be touched. One question is, how can businesses obtain PPE locally? Do you have any great words of wisdom on that?
I don't. And through our emergency operations center, we have a staff at EMS that has been trying to get the PPE for us. And I know that it's very, very hard to come by for businesses that need it, like the N95 mask for the hospitals. So I don't have any resources here in town to get PPE. And I don't know if they just need gloves or masks. I know the N95 masks that you have to be fit tested before are very hard to come by. United Way has been collecting cloth masks that the community has been making. So the United Way might be a resource for the cloth masks if you need those. And just remember, if you do wear those, they still need to be washed, and you need to take care of those because you can't throw them away. So products like that might be available through the United Way, but I don't know about another source for gloves or masks here locally. I'm sorry.
Mm-hmm. Paula Benny says, we have been open, just doors closed to the public. All processes moved to an online platform, which I think a lot of people are doing that.
Thanks too. We've all gotten better with technology.
That's the truth. All right. Anybody else have any parting questions? If you would like to speak, Kelsey can unmute you if you don't want to chat. Carrie, I see you are in the house. Carrie Turgeon, do you have any words from the city or any comments for Kristi?
I want to thank everyone for doing their part during all of this. And Kristi has been a fantastic leader, and we are so fortunate to have her. Thank you, Kristi, and your entire team at the health department and city, county working together. And I think I would just say that remember to look at colehealth.org for those 10 kind of pieces of advice and recommendations that Kristi put out. They're really good. I get calls multiple times a day, and a lot of those calls, the advice is in that information. So I refer people to Cole Health quite a bit. So please do that. She also has some great posts on Facebook and Twitter that you can share that information. So we just want to keep the community informed. So thank you all for doing your part. Thanks.
Carrie, I know that there's a large retailer on High Street that sells cards. Do you think that retailer will be open next week?
We are going to be reopened to the public on Monday, and we are open now for curbside pickup, and people like that they can just shop by FaceTime and phone. And I think that we'll have a lot of people continuing to use that convenience where you just call and we shop for you. I mean, how many people want to say, hey, I don't want to take the time. Here's the birthdays I have. You all figure it out. I'll just drive by and pick it up. And our girls have been really, really good at that. So yeah, you can still call. And that's the neat thing about this is all retailers and business owners have had to get really creative of how we can service our customers. And some of us actually like some of the new things that have come out of this. So we might be able to incorporate some of those fun new ways to shop. And regardless, there's been a great shop local movement, and we want to support our businesses in any way we possibly can. And so hopefully we'll keep that up as well. And I think we have a whole new value for our local businesses even than we ever had before.
That's right.
I echo what Joy Sweeney says, that personal shoppers are the best. So there are lots of, your staff does a phenomenal job, Carrie, as far as being a personal shopper. And I go in there to buy a card and I end up with 5 other things I didn't know that I needed. So they do a great job. Let me see, lots of cool new changes at Barbino. I might just add that if you guys have not seen our emails coming through pretty much every day, I think yesterday we sent out 4 emails trying to stay engaged with our chamber members. We have started Chamber Marketplace, and there is a list of either discounts, promotions from, I want to say, about 25 different businesses now. So we are trying to help our members as much as possible get some traffic through their doors, whether it's through gift cards or discounts. And so please take a look at that, and there's links on the website, and I think our staff's done a really good job promoting our members during this very trying time.
And I would like to thank everyone for their support. Like I said, we have a great team with the city and the county, and then several businesses have reached out to us and just appreciated my staff, and some have brought lunch or sent cards or flowers, and it's been greatly appreciated because sometimes in public health, it's, we're always here doing what we do behind the scenes, keeping people safe with communicable disease investigations or inspections or whatever, and we're not always in the limelight, and it's really great for my staff to get appreciated.
Well, your staff has done a phenomenal job, and if you haven't seen Kristy Campbell, like I said, on TV or radio, or Chesney Schulte, the communicable disease coordinator, she's done a fantastic job too. I know that in the 7 years that you've been at Cole County Health, I don't think that you've ever experienced anything like this before in your career. I'm so proud of how you've represented all of us in Cole County.
Thank you.
And lots of other people are commenting on the same, so thank you very much.
Thank you.
All right. Unless anybody has any parting words, let's go out and enjoy this 85-degree weather, and maybe this will help kill that virus. And
I hope so.
We can get back and having life as normal.
Missy, I have one short thing. Of course, you wouldn't say it yourself, but if you haven't heard the news or got the emails yesterday that went out to all chamber members, we are excited to announce that Missy Bono is our interim president / CEO as
congratulations.
first. So snaps for Missy.
Yeah, great job.
Thank you. I'm very, very excited. I think we're going to be going into some uncharted waters with this whole post-COVID, hopefully post-COVID. So I am very excited about the next 6 months and the rest of 2020, and very humbled and honored to be the interim president CEO. So thank you, Kelsey.
Awesome.
Thank you, guys. All right, we're going to go ahead and sign off. Thanks so much for everybody coming.
Thank
Have a
you.
wonderful weekend.